can't be the only one in the world with this condition. Let me know if you guys have this. Never met anyone else in the world with this except one of my cousins. Okay, so do you see this right here? So this is a birth vein, basically. And depending on the temperature or depending on how I'm feeling, you know, if there's a lot of blood pressure here, it goes up and down whenever it wants. It's kind of like it's alive. I'm feeling pretty good right now, so as you can see, it's pretty flat right now. Someone said that in my past life, I died in a car accident. That's why I have this. And one of my cousins, she had it right here, like on her finger, and it went away.
Am I tweaking?
I noticed it when I went through puberty that one of my boobs was growing and the other one wasn't. So I went to my doctor and they said, you haven't finished going through puberty yet. It's fine. It's nothing. It will grow. It's normal for women to have one bigger than the other. Come back if it hasn't changed in a few years. And at that time I was 13 or 14 years old, but I went back to my doctors again when I was 16 or 17 and they said again, you still haven't finished going through puberty. It hasn't finished developing yet. Come back again in a few more years. By that point, it was even more noticeable and I was having to stuff my bra with socks and I was wearing turtlenecks to hide it because I didn't want anybody to know. So I went onto the internet and I googled one boob, which I wouldn't recommend doing because there were some weird things that came up, but it found Poland syndrome. So I went back to my doctor and I said, I think this is what I have. And the doctor said, give me a few days and I will look into it and I'll get back to you. So then he called me up a few days later and he said, yes, I'm pretty sure this is what you've got, but I can't diagnose you with it because I don't know anything about it. So I will send you to the breast specialist at the hospital. So I went to the hospital to meet a breast specialist and she said, I have no idea what this is. As I was walking out of the room, walking down the corridor to leave with my mum, another nurse came down the corridor and she saw my chest and she said, oh my god, Poland syndrome, I've seen that before. Come and talk to me. So me and my mum went into this room and spoke to her and she said, yes, this is what it is. I've seen it once before in my entire career. Maybe you should go and see a different nurse. So I ended up seeing about 4 or 5 GP doctors, 3 nurses, 2 breast specialists and a surgeon, and I had to go to 3 different hospitals. And I can't remember if I was 20 or 21, but eventually my doctor sent me for an ultrasound scan and that showed that the muscle on this side is deformed. And a few times they'd said, yep, just call it Poland syndrome. Nope, it's not Poland syndrome because I don't know what Poland syndrome is. It can't be Poland syndrome, but I don't know what else it would be. Yes, it is Poland syndrome. They just kept diagnosing me and undiagnosing me and diagnosing me again. So I just gave up. I just stopped going back. I decided to just look for it online and each website I found had different information. So I decided instead to just find a community of people like me and ask them about how it affects them and kind of work it out for myself. My doctor told me when he did eventually find out what it was, that his teachers told him that he didn't need to learn about it in medical school because it was so unlikely that they would ever see it. They just assumed that they would never need to know about it. One of the doctors even told me at one point that I could name the condition because it was probably something that only I have and nobody else has it. I feel like I'm never really going to know completely everything about this condition. They still don't know exactly for sure 100% why it even happens, but I've just accepted that.
Get to know me better while doing my base makeup eyes were in part 1, so go watch that first. One thing here on TikTok that most people actually do not know about me is that I have a rare eye condition and it is called keratoconus. So basically what keratoconus is when the front layer of your cornea, the clear part, bulges outwards and it just kind of causes everything to look stretched and distorted and very, very blurred. I had to have a procedure called corneal cross-linking done, and if I didn't have that surgery, I honestly could have went black blind. People take vision for granted, and I never will because I felt and have a glimpse of what it is like to almost be blind. And like, it's crazy to me because I started my makeup journey and nobody really knew that I started it, and I literally couldn't even see what was right in front of me. Like, I'd be filming this close up and I wouldn't even be able to know what I'm doing. And honestly, I feel like that's why I could literally do my makeup a full face with my eyes closed. With the help of my contacts, they have saved my life. I wear scleral lenses. They're basically like a thicker plastic lens. Like, I could literally touch my eye, and that's what also makes my eye look so big. And a lot of people sometimes mention that like my eye, my pupil is like huge, but I think it's because my contact makes it look so big. My contact basically takes up like my whole cornea, and I have to use these little tools to put it in and out, and I have to fill it with saline. So if you ever want to see me put in my contacts, I'll do a video on it. In between filming videos and stuff back in the day when I tried to do YouTube, I would literally be bawling my eyes out in between each take because I literally couldn't see. And anytime I would do my eyeliner, like I would think I had it on my lid, but I swear it would end up being like so much higher up and things like that. And no one really believed me that like it was that bad. I spoke way more in detail about this condition and my experience with it a while back in my YouTube video. So like I said, if you want to check that out, go ahead and do so. But what is so crazy to me is how many doctors sent me home and told me, stop wearing makeup. That's why your vision is bad. It was so crazy to me how every single doctor would just read the last doctor's note and just agree with what they said, and they never cared to look further into it. I was literally 19 years old, maybe 18. It wasn't until I had a full-blown panic and anxiety attack in the doctor's office and went ape shit, excuse my language, on the doctor. Mind you, this was like my 6th doctor that I went through at this point, and I went crazy on her. And that's when she finally decided to take more scans and look more into it. Basically, from like 18 to like 23, I lived in the eye doctor's office. Like I was there 2 to 3 times a week. And just so you can slightly understand what keratoconus patients see like, this is what I see like without my contacts. The lights are blurred and everywhere. It gives me the biggest migraine. Running out of time, but leave questions if you want a part 2.
Okay, so yeah, I'll explain because I know that sounds crazy. So I was born with a disorder called uterine delphis. I still pronounce it wrong. So what that means is I was born with 2 uterus, 2 cervix, and 2 vaginas. Yeah, 2 vaginas. But I didn't find out that I had 2 vaginas. Like, I just thought that I was normal up until I got pregnant with my daughter in 2017. I had went for my first sonogram, and she was just doing the regular old sonogram, and the nurse tells me, has anybody ever told you that you have a bicornuate uterus? And I was like, what does that mean? So she was like, that means that you have like a split in your uterus. And I was like, okay, what's a uterus? And she's like, your womb, that's what a baby is. So she was like, can I do a vaginal sonogram so that I can, well, I mean, I'm saying sonogram, I meant ultrasound. But yeah, she was like, can I do the vaginal ultrasound so I could see how far the split goes down? And so she did it. And as she's doing the vaginal one, she's like, oh no, you don't have bicornuate uterus. She said, the split goes all the way down. You have uterine delphis. So I'm like, what does that mean? So she goes on to tell me, she said, you're pregnant right now, but in your other uterus, you can get pregnant again. So say if I'm 3 months pregnant right now, in my other side, I could get pregnant again, and it could be from a whole nother dad. Yeah, so they treated me like an alien. I had to get an ultrasound like every 2 weeks once I found this out, because since I have this condition, I have a shorter cervix. And I was like at risk for like early pregnancy, so I would get an ultrasound like every 2 weeks. But every time I would go to get an ultrasound, like all the nurses would be like, oh, can we come in to watch? Like, this is a learning experience. And also, when I get a pap smear, I have to get 2 pap smears. So I get a pap smear for the left side and the right side. And I have a son and a daughter. So when I was pregnant with my daughter, she was in my left womb and my son was in my right womb. Oh yeah, and for the 2 vaginas, I have a hole and it's like a split in the middle. So yeah, the vagina hole is a split in the middle. It's like a septum. So it's 2 different sides. So yeah, it looks normal though. But yeah, that's the explanation. Oh yeah, and when it was time to have my daughter, I had to have an emergency C-section because of me having 2 cervix. When my daughter was trying to come out, both of my cervix were opening at the same time, like they was taking turns, and I could not even explain childbirth having 2 cervix. Like, I literally was going crazy. Like, they had to put me to sleep. I woke up and my daughter was alive, and I was like, "How'd you get here?" But yeah, that's all I got to say about that.
I was born with a rare visual condition called achromatopsia, which is total color blindness. The sky is always gray, flowers are always gray, and television is still in black and white. Since the age of 21, instead of seeing color, I can hear color. It's a color sensor that detects the color frequency in front of me and sends this frequency to a chip installed at the back of my head, and I hear the color in front of me through the bone, through bone conduction. This is the sound of purple. For example, this is the sound of grass. This is red, like Ted. This is the sound of a dirty sock, which is like yellow, this one. Going to an art gallery, I can listen to a Picasso, for example. So it's like going to a concert hall, because I can listen to the paintings. And supermarkets, I find this is very shocking, very, very attractive to walk along a supermarket. It's like going to a nightclub. It's full of different melodies. Yeah. Especially the aisle with cleaning products. It's just fabulous. Also, the way I dress has changed. Before, I used to dress in a way that it looked good. Now I dress in a way that it sounds good.
Hi, my name's Connor. I'm a nurse, and these are a list of medical conditions that have caused me to lose sleep since I've learned about them. If you have medical anxiety, just go ahead and scroll past this one. Number 1, we have cerebral AVM. That's an arteriovenous malformation. It basically means you have funky blood vessels in your brain that could just burst at any time, completely without warning. I saw it happen one time in a neuro ICU, and I'm convinced I'm growing one in my brain. Number 2 is prion diseases. There are literally no words in the English language that could express how terrified I am of this. If you know, you know. That's not even a separate TikTok. That's like a 6-hour-long video essay. Number 3 is trigeminal neuralgia. To be honest, I'm just a big baby when it comes to my face. Literally nothing about this sounds fun. I've met a couple people who have this, and I have audibly winced when they told me they have it. Y'all are warriors. Number 4 is dehiscence or evisceration of a surgical wound. When I was a freshman nursing student, a senior nursing student came home from clinical and told me that she saw a patient's wound dehiss. I looked up a picture, and dear reader, I should not have looked up a picture. It scared the snot out of me ever since, and I've seen it happen. Number 5, we have Guillain-Barré. Before you comment that I pronounced it wrong, shut up. I convinced myself I had this my senior year of college. I didn't, but I freaked out enough that I still lose sleep about it.
This teenager has robotic arms.
These are Crazy Medical Conditions, Part 6.
13-year-old Tilly grew up without arms, making her life very difficult. However, Tilly has now become the first person in Britain to receive a 3D printed robotic arm, which has allowed her to take control of her life again. Comment what you think about this.
Okay, I just found out something. Apparently, I have multiple layers of eyelashes, and apparently it's only normal to have one. I did a video of an eye transition, and someone commented this, and I was like, what are you talking about? This was what they were look at my eyelash. I didn't realize that everyone just has one. Look how many layers there are. Like, here's a photo without the filter. Like, when I tell you I ran downstairs to the person that I live with to be like, can I see your eyelashes? She only has one row. Then I did some research, and it said a double row is quite rare. How many rows do I have? Like, that's more than 2. That's like... Can y'all confirm that y'all only have one row of eyelashes? What? I'll give you a back camera view of them, 1 second. Like, what is going on? Some of y'all have this too, right? Like, this is not just me, right?
This girl lives in a plastic bowl.
These are Crazy Medical Conditions, Part 15.
19-year-old Rama has a rare medical condition which has caused her not to develop any arms or legs. Her family keeps her in a plastic bowl, which they carry to help her move around. Comment what you think about this.
This is the woman who has a phobia of food, and you won't believe how she lives. Her name is Jill Heyman, a 36-year-old from Montrose, Scotland, who suffers from an incredibly rare condition called restrictive food intake disorder, which she believes began at 8 months of age, causing her to have a meltdown at the sight, smell, or even thought of certain foods. At 91 pounds, she has never sat down to eat a proper meal with a knife, fork, and has a list of 18 quote-unquote safe foods that she consumes, including chocolate, candy, chips, energy drinks, and bread, which makes up most of her diet. She also depends on supplements because of malnutrition. What do you guys think?
My bones are black. Like, the bones in my body are black. And it's because I have something called minocycline black bone disease. When I was in middle school and high school, I had really bad acne, and I used a medication to treat it called minocycline. Well, it turns out that minocycline can stain your bones. My skeleton is really cool. So how do you find out that your bones are black? Well, you gotta have exposed bone. My wisdom tooth came in and it was black, and I was like, oh my god, my teeth are rotting. And it turns out that my jaw is black, and probably the rest of my skull, and most of my bones, according to my doctor. My big teeth came in before I started using minocycline, so not affected.
Y'all, story time again. Let's go. Alright, y'all. My condition is called linear knee visceration syndrome. I was born with it. I've lived like this my whole entire life. So yes, there's the main question being addressed. I've lived with it my whole entire life. Has it always been this big? No. It used to be flat. If you go back to my other pictures and stuff, you'll see that it used to be flat. It was not bumpy. None of that. It started growing once I started having children. Yes, my eye is a part of my condition. It's one of the abnormalities that come with it. I'm partially blind in that eye. I do not use it. My body only uses this eye. It's lived with it my whole entire life. The more I keep having kids, the bigger it gets. Will I be having any more kids? No. Can I pass it to my kids? No. None of them have it. And no, I did not get it from anybody in my family. And nobody in my family has it either.
February 28th is Rare Disease Day. Millions of people suffer from rare diseases, and you might not always see them, including mine. I suffer from epidermolysis bullosa simplex. While you may not always be able to see it, it's a daily struggle. You never know what someone's going through, so be kind.
Hey Bear Cubs, how's it going? So, after my last video with the tusks and everything, there's a lot of new folks here, and I have gotten this question quite a bit. So, let's get back into it. I have a condition known as CVG, or bulldog scalp. It's essentially a thickening of the skin on the top of my scalp, or in the back of the head. When I was younger, I was in a car accident, unfortunately, that needed me to have skin moved forward, which caused the fissure that you see on my forehead to be more prominent than it would have probably been. But it doesn't hurt. It's not a scar. The scar is up here, actually, somewhere. But yeah, I'm perfectly fine. So, good times.
People with this condition can't move their face. And it's called Ramsay-Hunt syndrome, and it's caused when a virus infects one of the nerves in your face, leading to a bunch of symptoms including facial paralysis. And this is actually the condition that Justin Bieber was recently diagnosed with.
Hi, I'm Lizzie, and I have a rare brain condition. It's called idiopathic intracranial hypertension. And a lot of people don't know what that is. So I'm here to explain it. Let's start with the basics. This illness actually has two names. The first is idiopathic intracranial hypertension, shortened to IIH. Idiopathic means they don't know what caused it, intracranial means inside your brain, and hypertension is exactly what it sounds like. It's tense up there. You might also hear the second name, pseudotumor cerebri. Pseudo, fake, tumor, obvious, and cerebri, brain. The reason pseudotumor cerebri is also a name for it is because this condition mimics all the symptoms of a brain tumor without one actually being present. The thing that caused mine is most likely a rare reaction to antibiotics and hormonal birth control. Now let's get into the symptoms. It starts with headaches. They feel like migraines, and then they slowly get worse. For me, the headaches were so bad that medication wouldn't help. It's because they're not normal headaches. It's caused by the cerebrospinal fluid that cushions your skull and your spine being way too high in pressure. Kind of like if a bike tire overinflated and it's about to pop, same thing. If you end up with headaches that don't go away, they might not be migraines, they might be something else. Especially if they progress to the next symptom, which for me was nausea and vomiting. For more information on my story and how I ended up getting diagnosed with this, I do have a couple videos up. Just scroll a little, they'll be right there. But for this video, I'm not going to talk about it. Anyway, The pressure headaches will then progress into nausea and vomiting, ringing in your ears, neck, shoulder, and back pain, and for me, it was dizziness, confusion, brain fog, and being unable to stand. I experience a lot of balance issues on the daily, my coordination's not the same, and I experience serious brain fog. When the condition progresses, it then moves on to the eyesight. So for me specifically, I experienced visual snow. If you don't know what that is, it's like seeing TV static 24/7. Kind of weird. And then once the headaches and pressure started getting worse, I started experiencing double vision, vision loss, and actually woke up blind a couple of times. Not fun. If the condition gets even worse, it can progress into something called papilledema. Papilledema is when the cerebrospinal fluid pushes on your optic nerves to the point where there's so much pressure that they fray. For me, I lost a little bit of peripheral vision and I'm still working on getting that pressure back down. I'll talk about the treatment in part 2.
Some of you cannot take your bath again because anytime you enter shower, you come out, you scratch your body for the next 30 minutes.
You plenty.
You've changed towel, you've changed house, you've sacked your landlord because you think these are the problems. Sometimes it's not. Maybe because you have a condition known as aquagenic pruritus where there's abnormal immune system or even cellular or nervous system. There are some things you can do to help mitigate this condition. Number 1, use warm water. I do not say hot water there is to boil chicken. Number 2, add some baby oil to that water and it might help it. Number 3, stop using sponge to scrub your skin. Sometimes that sponge may activate some mast cells which make the itching worse. Number 4, rub cream on your body when your body is still wet. Number 5, stop using antiseptic soap. It's just damaging your skin and we'll discuss that in another video. But if these conditions do not stop after you've tried all these things, my dear, go and see your doctor.
Hey guys, I decided I wanted to go a little bit more in depth with the condition I was talking about earlier on my story. Please excuse me wearing my hood. My hair is not really up to standards right now, but I thought I'd explain a bit what it was and how it affects me. So let's get into that. As I said in the story, my condition is called congenital generalized lipodystrophy. I'll put the spelling somewhere on the screen. But basically, in the simplest terms I can describe it, my body cannot produce and store fat correctly. So that's where my muscles come from that you guys see sometimes in videos. I don't work out or anything, it's just the condition. It's what also leads to my diabetes because all that stuff sort of works together. You know, fat, insulin, your pancreas. I don't really know how to describe it because even I don't understand it the best, but basically all that stuff works together and that's what causes me to have my form of diabetes. So yeah. Along with that, I have to take a stronger insulin than other diabetics would, and a medicine called leptin for the generalized lipodystrophy. That really is a mouthful. Oh gosh. But I just thought I'd talk about it a little bit, and I guess now I'll explain how it's affected me throughout my life. So going back to when I was younger, the effects it had on me wasn't physical, but more mentally, emotionally, that sort of stuff. So, basically ever since I was younger, you know, everyone would see my muscles and be like, oh, you're so strong. Do you work out? You're so strong. And, you know, being a socially awkward little child, hearing that all the time, it really got to me. And so at a certain point, I think maybe around like 4th grade, I'd only really wear hoodies all the time, any long sleeves, you know, just to sort of avoid hearing those comments. Keep in mind, it was around that same point where I had first got diagnosed, around like 3rd, 4th grade. So, you know, I'm trying to figure all this stuff out and trying to avoid all those comments. And, you know, that's what led me to hide my arms and stuff. But I'm at a point now where the comments don't really bother me as much. I tend to play into the jokes and stuff. But, you know, just thought I'd explain it a bit. Also, I have scars on my arms. I don't know. Sometimes they're visible in videos. Just know that those are medical from my leptin injection. Like I said earlier, the leptin. So, I'm not going to put any trigger warnings for that anytime they're clearly visible. But yeah, that's it.